So developmental considerations. So when we're looking at growth and developmental theories, how does it relate to our population? Excuse me, Erickson's developmental theory, understanding what the first 5 stages are as they relate to childhood. As you get older, your young adult, middle age, and older adult are obviously not related to pediatrics, but understanding what is involved in the trust versus mistrust stage, your toddler stage, preschool, and school age. Okay. And so I'm having a good understanding of those concepts and how they relate to caring for your child and nursing interventions along the way. The other developmental consideration you want to look at is Piaget's cognitive development theory. What does that look like? Here is a little chart that kind of breaks it down for you. That's always helpful. And so there are 4 stages that you're going to want to think about: your sensory stage, your pre-operational stage, what's in your concrete operational stage, and then your formal operational stage. Okay, so those are things that you want to think about sequentially and what that looks like as they get older. Okay. Is there anyone online that has experience in pediatrics? Feel free to write in the chat if you can. So I've spent quite a bit of my years in pediatrics. I've done pediatric critical care, and which I liken it to med surg. I feel like in that area you get just all these medical diagnoses, and then I started specializing in CDICU. So it's the cardiovascular surgery part of that, and that's where I was an educator and manager. Now the pediatric ICU has generally everything that you come across, and so there is some new school and old school thought on that. I've done pediatrics. I left when I was out of nursing school. I did a very short stint in short stay surgery, probably about 2 months or so, and then I went into pediatric critical care. Now, my thought is that go into an area that you are passionate about. I am never under the inference that you should go into an area because you will gain this certain experience in order to take to another area. Sometimes we can get, and nursing can be specialty. You can be very specialized in whatever area that you go into. And having a general understanding of all areas is very important, but I am passionate about being in an area that you enjoy or you have an interest in and exploring that, because that will give you your tenure, that will give you your longevity, that will allow you to treat your patients and care for them because you have a vested interest, as opposed to I'm just doing my 1 year in ER because I need to be a nurse practitioner, or I'm just doing my 1 year in med surg because I want to, go into OR or something like that. So that's my only caveat. That's my little advice that I always that I like to share with people. So pediatrics is always an area to be in. Some people, and so that being said, I've met a lot of people in a lot of people not in pediatrics, and they're terrified of kids, and they're not really that bad. I'm here to tell you, it's not that bad. But then that's what I know, right? So that's my